OCO, Victoria O'Keeffe, Dagwado, Cherokee. Hello, my name is Victoria O'Keeffe. I am Cherokee Nation and Seminole Nation from the United States. I have a PhD in clinical psychology, and I'm currently an assistant professor at the Johns Hopkins Bloomberg School of Public Health, and we have a Center for Indigenous Health. And while I was trained as a psychologist and really focused on mental health, I also really resonate with public health approaches to mental health, which are really community-based, and I think that's really in line with many of our Indigenous communities and how we view mental health as really inseparable from physical health, spiritual health, and inseparable from family, relationality, land, community, and culture. That's a great question. I mentioned in the webinar we did earlier that my grandmother, who passed away a few years ago, she's been a huge inspiration to me, not only in my work, but in my life. And she was a community health representative for our tribe. So she took care of our communities, and she would drive out, and she was a fluent Cherokee language speaker, and she took care of our people. And so in essence, she was working in public health in many ways. And she told me, when you get your education, you work for your people. And really what she meant by that was many of our Cherokee community values, that we care for our community. And that's really what keeps me in this work. And I've had incredible mentors, and there's still such an underrepresentation within the United States of Indigenous psychologists and those of us working in mental health. And so I hope to pave a path for future generations of Indigenous peoples within mental health as well. I continue to learn so much. It's been such a privilege to be part of this powerful group of all Indigenous people from all parts of the world. And I think when we talk, it's almost like we're family. There are so many similarities. Of course, we have so many differences within our Indigenous communities, but I think it's really powerful when we come together and we learn from each other and we can share knowledge with each other. I hope that we can be in a place where our Indigenous communities are determining the ways that they're addressing mental health, and much of that can be related back to our Indigenous knowledges and ways of living and being. And those are the ways and practices that have sustained our mental health and our physical health and our spiritual health for generations upon generations. I just want to say that every single young person is strong. You come from strong ancestors for you to be here today, and you're paving the way for strong future generations to come. Our Indigenous ways of knowing and being and our cultural traditions have sustained our communities since time immemorial, and that's not just related to health, that's just thriving, that's life, that's the way that we've lived. And I think that is a core part of identity and culture, and that promotes mental health and well-being in general. So many of our communities have knowledges and traditions that are really based on land, and you really can't separate land from health and well-being. It's so interconnected, and that must be understood in terms of mental health and emotional well-being. I think my hope is that we as Indigenous peoples within these spaces continue to come together, and as well as Indigenous communities, not just those of us with academic degrees who might be working in clinical settings or academic settings, but I hope that all of us and our voices continue to be uplifted, and that our ways of knowing, our ways of being, our frameworks are really uplifted, and that everyone understands the ways that the entire world's well-being is linked to Indigenous people's well-being.